Assalamu alaikum students. I hope you all are fine. On the behalf of Anatomy Department, Akhtar Said Medical and Dental College, I am Dr. Amna Rafeel, welcoming you all on my today's lecture, that is peritoneal reflections and the ligaments and the internal surface of anterolateral abdominal wall. So students, I hope you must have developed a very true concept about what peritoneum is, what are its two layers, and what are its folds, what are the functions of the peritoneum, and what are its folds associated with the viscera, and how it is supporting the visceras, and how it's making peritoneal ligaments, and what those ligaments are connecting in your previous classes. So I'm here again describing you the basic definition of the peritoneal ligaments. That is, a peritoneal ligament consists of double layer of peritoneum that connects an organ with another organ or to the abdominal wall. Students, moving towards the peritoneal ligaments of the liver, these are the double layer fold of peritoneum and that are connecting the liver with other viscera and as well as to the anterior abdominal wall. So these ligaments, the liver has other ligaments as well, and the majority of the liver ligaments are the embryological remnants of the blood vessels, and which have later on regressed. So the ligaments made up of peritoneum, which are connecting or which are associated with the liver, are the Felsiform ligament, and this is the Felsiform ligament. You see, this is a sickle-shaped fold of peritoneum connecting the liver with the anterior abdominal wall, and reaching the superior surface of the liver, it divides into right and left margins. Then we have the coronary ligament, and these attaches the liver. It has superior and inferior layer, and it attaches the liver to the diaphragm and to the right kidney and the adrenal gland. Then we have the triangular ligaments, which are right and left on both the sides. These are asymmetrical, and they covers the both the lobes of the liver at the right and the left ends. And then we have the lesser omentum, that is basically an L-shaped fold of peritoneum that connects the undersurface of the liver to the lesser curvature of the stomach in the first part of the duodenum. That has two parts, the hepatogastric and the hepatoduodenal parts, which you must have studied in your previous lectures. So coming up with the first peritoneal ligament associated with the liver, that is a Felsiform ligament. As the name indicates, it's a sickle-shaped fold of peritoneum that connects the anterior abdominal wall with the liver and slightly to the right of the median plane. So students, here is a picture of a sagittal section showing this in the liver, and this is the diaphragm, and this is the Felsiform ligament. You will see this is sickle-shaped fold of peritoneum, and that connects the liver with the anterior abdominal wall. So this is the anterior abdominal wall, and this is the liver, and this ligament has anterior border, and it has a posterior border, and it has a lower free margin. So the anterior border is attached to the undersurface of the diaphragm. You can see this is the anterior border, and it is attached to the undersurface of the diaphragm as well as the anterior abdominal wall. So this is the anterior border attaching continuous with the undersurface of the diaphragm, and it is attached to the anterior abdominal wall. The posterior border is attached to the superior surface and the anterior surface of the liver. So this is the posterior border, which is associated with the superior and the anterior surface of the liver. And it has a lower free margin that connects the liver with this umbilicus. And it has the round ligament of the liver, also known as the ligamentum teres. So the next peritoneal ligament associated with the liver is the coronary ligament. So the peritoneum that lines the undersurface of the diaphragm, it is reflected onto the superior surface of the right lobe of the liver, forming the upper layer of the coronary ligament. So here you can see this is the diaphragm, and the peritoneum that lines the undersurface of this diaphragm is reflected onto the superior surface of the liver, and this reflection forms the superior layer of coronary ligament. So this is the diaphragm, and the peritoneum on the undersurface of the diaphragm is reflected onto the superior surface of the liver, and this reflection forms the superior layer of coronary ligament. Then it further on reflecting from the superior surface, forming a superior layer of coronary ligament, then it continues forward onto the anterior surface of the liver, then it goes to the inferior surface, and then on reaching the posterior part of this inferior surface, it is reflected onto the front of the right kidney and the right suprarenal gland. So you can see this is reflecting in front onto the front of this right kidney and the right suprarenal gland, and this reflection towards the kidney and the right suprarenal gland is forming the inferior layer of the coronary ligament. So the diaphragm from the peritoneum from the undersurface of the diaphragm reflecting upon the superior surface of the liver, forming the superior layer of coronary ligament. Then that reflection becomes continuous on the anterior surface and the inferior surface. On reaching the posterior part of the inferior surface, it is reflected onto the front of the right kidney and the right suprarenal gland, and forming another reflection, and that is known as the inferior layer of coronary ligament. So here you can see there is a part of a liver between this superior layer of coronary ligament and the inferior layer of the coronary ligament that is devoid of peritoneum. There is no peritoneum present between this superior and inferior layer of coronary ligament. This area of the liver is known as the bare area of the liver, which has no peritoneal covering, and that area of the liver is in direct contact with the diaphragm. So here you can see that this is the superior layer of the coronary ligament, the right lobe of the liver, and this one is the inferior layer of the coronary ligament. And the part of a liver between this superior layer and the inferior layer of the coronary ligament is known as the bare area of the liver, and this bare area of the liver is the area which is devoid of peritoneum, and it rests directly upon the diaphragm. So coming up with the right and left triangular ligaments, I have told you before that these are the two asymmetrical ligaments present on both the lobes. And the right triangular ligament, it's a short V-shaped structure. You see, this is this short V-shaped structure. This is known as the right triangular ligament. How this right triangular ligament is formed? By the approximation of the two layers of the coronary ligament. So you see, this is the superior layer of the coronary ligament, and this is the inferior layer of the coronary ligament, and these two meet at the right lateral end. They approximate at the right lateral end and form the right triangular ligament. So this superior layer of this coronary ligament becomes continuous with the right margin of the falciform ligament. So you see, this is the right margin of the falciform ligament that becomes continuous with the superior layer of the coronary ligament on the right side, and the superior and the inferior layer, they converge together at the right lateral end to form the right triangular ligament. Coming up to the left triangular ligament, this is, you can see, it's a narrow, elongated, and it's a double layered and present on the upper border of the left lobe. So this is the left lobe of the liver, and this is the right lobe of the liver, and this is the left lobe, and it is present in the upper border of the left lobe of the liver. So basically there is no true coronary ligament present on the left side. So what happens, that this left margin of the falciform ligament, it extends backward and forms the anterior layer of this left triangular ligament, while the posterior layer is formed by this extension from the left margin of lesser omentum. So there is no true coronary ligament present on the left side. The left triangular ligament is formed by the extension, a continuation of the left margin of the falciform ligament along the upper border of the left lobe of the liver, while the posterior margin is formed by the continuation of the left margin of this lesser omentum, which is attached along the porta hepatis and this fissure for ligamentum venosum. So becomes continuous with the forward along the upper border of the left lobe to form the posterior layer of the left triangular ligament. So the left triangular ligament, it has anterior and posterior layer. The anterior layer is the continuation from the left margin of the falciform ligament, and posterior layer is the continuation from the left margin of the lesser omentum. So coming up with the next peritoneal ligaments associated with the liver include the hepatogastric ligament and the hepatoduodenal ligament. These two ligaments you people must have studied as a part of lesser omentum in your previous lectures. I would just like to mention their contents for the purpose of your revision over here. The hepatogastric ligament was a part of lesser omentum that connects the undersurface of the liver with the lesser curvature of the stomach. That ligament contains the right and left gastric arteries, gastric group of lymph nodes and lymphatics, and the branches from the gastric nerves. Then the second part of the lesser omentum, which was connecting this undersurface of the liver with the first part of the duodenum, is known as the hepatoduodenal ligament. It has a free margin of lesser omentum as well. It consists of bile duct, portal vein and proper hepatic artery, lymph nodes and lymphatics, and the hepatic plexus of nerves. So moving forwards towards the peritoneal ligaments, which are associated with the stomach. You people must have studied in your previous lectures about the folds of the peritoneum that were associated with the lesser curvature and the greater curvature of the stomach as the lesser omentum and the greater omentum respectively. You have studied these two structures in detail, and you have studied about the divisions of this lesser omentum as well and the contents of these ligaments as well. Similarly, there are further parts of the greater omentum that is associated or that is connecting the stomach with other viscera as well. So that includes the Gastrophrenic Ligament, the Gastrosplanic Ligament, Gastrocolic Ligament and the Gastropancreatic Ligament. So here you see the nomenclature is easily depicting that which two areas are connected by these ligaments. The Gastrophrenic is connecting the stomach with the diaphragm. Gastrosplanic is connecting the stomach with the spleen. Gastrocolic is connecting the stomach with the transverse colon, and the gastropancreatic is connecting the stomach with the pancreas. So we won't go in the long detail of this ligament, but we will localize these ligaments on the diagram in the next slide. So here you see, this was the lesser omentum attached to the lesser curvature and the first part of the duodenum, connecting this to the liver, which has two parts, the hepatogastric and the hepatoduodenal part. So on the other hand, the greater omentum was attached onto the greater curvature of the stomach, and you have studied the detail where it goes and where it is attached. So the parts of the greater omentum that connects the stomach with other viscera, we have labeled and categorized them according to their names. So the Gastrophrenic ligament you see over here, this is a Gastrophrenic ligament. It is connecting the stomach with this diaphragm. So this is a Gastrophrenic ligament, and it is categorized under the part of greater omentum. Then you will see over here, this is the Gastrosplanic ligament. This is a spleen, and this ligament attaching this stomach with this spleen is known as the Gastrosplanic ligament. Similarly, this is the greater omentum, and part of this, which is connecting the stomach with the transverse colon over here, you see this one is known as the Gastrocolic ligament. So this goes downward and is reflected upon and is attached to the transverse colon, and it forms the Gastrocolic ligament. So part of the greater omentum that connects the stomach with the transverse colon is known as the Gastrocolic ligament. Part of a greater omentum that connects the stomach with the spleen is known as Gastrosplanic ligament, and part of the greater omentum that connects the stomach with the diaphragm is known as the Gastrophrenic ligament. Similarly, there will be the part of a greater omentum of there will be a peritoneal ligament that will be connecting this undersurface of the stomach with the pancreas, and that will be known as the Gastropancreatic ligament, that is not shown over here. Students coming up with the peritoneal ligaments associated with the spleen, and that includes the Gastrosplanic Ligament, Splenorenal Ligament, Phrenico Ligament and Splenocolic Ligament. The Gastrosplanic Ligament includes a double layer of peritoneum that connects the fundus of the stomach to the hilum of the spleen. And in this double layer of peritoneum are running the short gastric and the left gastroepiploic vessels. So you see, this is the transverse section and showing you this is the stomach and this is the spleen. This is the left kidney and the right kidney, and you see there is a double layer fold peritoneum between this stomach and the spleen. So this one is the Gastrosplanic ligament connecting the stomach with the spleen, and it contains the short gastric vessels and the left gastroepiploic vessels. So this is Gastrosplanic ligament. Then Splenorenal ligament extends between the hilum of the spleen and anterior aspect of the left kidney, and splenic vessels lies within this ligament as well as the tail of the pancreas. So students, this ligament you are seeing between this left kidney and the spleen, this one is the splenorenal or lenorenal ligament. This one is the Splenorenal Ligament, and it contains the splenic vessels as well as the tail of the pancreas. So the Phrenicosplanec and the Splenocolic Ligament I will discuss you in the next slide. So students, please don't get worried about listening to these long names of the ligaments. You just have to break up the nomenclature, and that will easily help you to determine what structures those peritoneal ligaments are connecting. So over here students, you see this is the spleen and this is the pancreas, and this ligament over here you are seeing, this is the Gastrosplanic Ligament, and this Gastrosplanic Ligament connects the fundus of the stomach with the hilum of the spleen, and this Gastrosplanic Ligament contains the short gastric vessels and the left gastroepiploic vessels, and this ligament over here you are seeing is the Splenorenal Ligament or Linorenal Ligament, and it contains the splenic vessels and the tail of the pancreas. You see this tail of the pancreas, it's included in this ligament. So this is Splenorenal or Linorenal Ligament. Over here you seeing is this another ligament which is associated with the spleen, but actually it's not attached with the spleen. So this is the Phrenico-Colic Ligament. You see this is the diaphragm and this is the transverse colon. So this Phrenico-Colic Ligament, it connects the diaphragm with the colon, and basically it's supporting the lower end of the spleen, and it prevents the downward displacement of the spleen in case of any enlargement. You see this is the spleen and this is the Splenocolic Ligament that connects the spleen with this left colic flexure, and this is known as a Splenocolic Ligament. So students, over here you see the ligaments, the peritoneal ligaments associated with the spleen. So this is the Gastrosplanic Ligament. I have discussed this with you previously, and this is the Splenorenal Ligament, and over here you see this is the Gastrosplanic again. This is Splenophrenic Ligament and connecting the spleen with the diaphragm, and this is Splenocolic Ligament connecting the spleen with the transverse colon or the splenic flexure of the colon. So you see, you just have to focus on the nomenclature of the ligaments to determine which two areas those ligaments are connecting. So coming up with the last part of our today's lecture, that is the peritoneal folds and foci on the internal surface of the anterolateral abdominal wall. So they are the peritoneal reflections you have studied around the visceras, peritoneal ligaments, which are connecting the organs to each other, are connecting the organ to the abdominal wall. So similarly, we have several peritoneal folds and foci on the internal surface of the anterolateral abdominal wall, or also known as the posterior surface of the anterolateral abdominal wall. So the internal surface of the anterolateral abdominal wall is covered with fascia transversalis, variable amount of extraperitoneal fat and parietal peritoneum. So the infraumbilical part, that is the part of the posterior surface of the anterolateral abdominal wall below the umbilicus. So the below the umbilicus of the part, it exhibits 5 umbilical peritoneal folds passing towards the umbilicus, 1 on median plane and 2 on each side. So you see this is the posterior surface of the anterior abdominal wall. So this is the posterior surface of the anterior abdominal wall, and this is covered with the fascia transversalis and extraperitoneal fat and parietal peritoneum. And this is the umbilicus, and below this umbilicus, that is the infraumbilical part of this posterior surface of the anterior abdominal wall, it exhibits 5 umbilical peritoneal folds. So there are 5 peritoneal folds present on the infraumbilical part of the posterior surface of this anterolateral abdominal wall. One in the median plane and 2 on each sides. So this is the peritoneal fold present in the median plane, and 2 folds on each side of this median plane. So students, over here in this diagram, you see this is the posterior surface of the anterolateral abdominal wall, or internal surface of the anterolateral abdominal wall. So we studied that there are 5 peritoneal folds present on this posterior surface of the anterolateral abdominal wall, and 1 fold is present on the median plane. This blue arrow shows this one is the median fold, and 2 on either side. You see 1 and 2, and then 1 and 2. Two folds are present on either side of this median fold. So what are those folds known as and what those folds are covering? So we'll study them over here. Number 1 is the median umbilical fold. So you see, this is the median umbilical fold. It extends from the apex of the bladder, urinary bladder. So this is the urinary bladder, extends from the apex of the urinary bladder to the umbilicus. So this is the median umbilical fold. This fold and that ligament is known as the median umbilical ligament, which is a fibrous remnant of urachus that you will study in embryology. So median umbilical fold in the median plane covering the median umbilical ligament, and that ligament is basically an embryological remnant. Then the fold on the either side of this median umbilical fold is the two medial umbilical folds. So this peritoneal fold in the median plane was median umbilical fold, and the peritoneal folds present on the both the sides of this median umbilical fold are known as the medial umbilical fold. So these are just lateral to the median umbilical fold. And what structure they are covering? They are covering the medial umbilical ligaments. So these are the medial umbilical folds on either side of this median umbilical fold, and these are covering the medial umbilical ligaments, which are the occluded parts of umbilical arteries. Then further on we go laterally. So we have the lateral umbilical folds. So these are the lateral umbilical folds, and they cover the inferior epigastric vessels. So what we studied, students, over here, this was the posterior surface of the anterolateral abdominal wall, and there are 5 peritoneal folds present at the infraumbilical part. So below the umbilicus we have 5 peritoneal folds present on the posterior surface of the anterolateral abdominal wall, and those include the median umbilical fold covering the median umbilical ligament going from the apex of the urinary bladder to the umbilicus, and that ligament was a embryological remnant of urachus. Then we have medial umbilical fold covering the medial umbilical ligament, and what that ligament is, it's a occluded part of umbilical artery. And further on laterally we have lateral umbilical folds on both the sides, and those umbilical folds contains the inferior epigastric vessels. So 5 folds, and these folds will be having fossas in between them, that we will study in the next slide. So the peritoneal foci, the depressions lateral to the umbilical folds, which I have mentioned you in the previous slides, are the peritoneal foci, each of which is a potential site for a hernia. The location of the hernia in one of these fossa determines how the hernia is classified. The fossa includes the supravesical fossa, the medial inguinal fossa, and the lateral inguinal fossa. So see what happens, that the folds which we have studied in the previous slides, that is the median umbilical fold, the medial umbilical folds, and the lateral umbilical folds, they have fossa in between them. And those fossas are categorized as supravesical, medial inguinal, and lateral inguinal. And those fossas are the potential sites for the hernia. That is, those are the weak areas from which the viscera can protrude out. And the location of the hernia in one of these fossa will determine how the hernia is being classified. Students, let's proceed towards the fossa. I told you in the previous slide that there were peritoneal folds present on the posterior surface of the anterolateral abdominal wall. So this is the posterior surface of the anterolateral abdominal wall, and these are the 3 folds you can see very easily. This is the median umbilical fold containing the median umbilical ligament. This is the medial umbilical fold containing the medial umbilical ligament, and this is the lateral umbilical fold containing the inferior epigastric vessels. So the fossas will be located between these folds. The number 1 is the supravesical fossa, which is present between the median and the medial umbilical fold. So you see, students, this is the median umbilical fold and this is the medial umbilical fold, and this green ring over here you seeing is the supravesical fossa. Then the medial inguinal fossa is present between the medial and the lateral umbilical folds, and it is also known as the inguinal triangles or Hazelbeck's triangles and the potential sites for direct inguinal hernia. So this is the medial umbilical fold, and this is a lateral umbilical fold, and the depression present between or fossa present between these two folds is known as the medial inguinal fossa, also known as the inguinal triangles or Hazelbeck's triangle. So students, if you remember my previous lecture, I told you the location and the boundaries of the Hazelbeck's triangle. If you remember that the lateral boundary of that triangle was formed by the inferior epigastric vessels. So this is the lateral boundary of that triangle, and this will be the Hazelbeck's triangle, and it is also known as the medial inguinal fossa. And if you remember, I told you that the type of hernia that protrudes through this inguinal triangle or Hazelbeck's triangle or medial inguinal fossa will be known as direct inguinal hernia. So lateral inguinal fossa is lateral to the lateral umbilical folds, and that includes the deep inguinal rings and are the potential sites for the indirect inguinal hernia. So students, this is the lateral umbilical fold, and the fossa or the depression lateral to this is known as the lateral inguinal fossa. So this is the lateral inguinal fossa, and this area includes the deep inguinal rings. That was the gap in fascia transversalis, and the hernia that will be protruding through it is known as the indirect inguinal hernia. Similarly, as we studied that there were peritoneal folds present on the posterior surface of the anterolateral abdominal wall at the infraumbilical level. Similarly, at the supraumbilical part of the internal surface of the anterolateral abdominal wall, it has sagittally oriented peritoneal reflection, that is a Felsiform ligament, that extends between the superior anterior abdominal wall and the liver. So students, this is a very good diagram showing you all the peritoneal folds and foci in the one picture. So you see, this is the umbilicus, and this is the infraumbilical part of the posterior surface of the anterolateral abdominal wall, and this is the supraumbilical part of the posterior surface of the anterolateral abdominal wall. So over here you see, this is the bladder and this is the umbilicus, and this fold present, this peritoneal fold going from the apex of the urinary bladder towards the umbilicus is known as the median umbilical fold, covering the median umbilical ligament. Then this is the medial umbilical fold covering the medial umbilical ligament, and this is the lateral umbilical fold, and that covers the inferior epigastric vessels. You can see the vessels running behind it. And the fossa present between the median umbilical fold and the medial umbilical fold is known as the supravesical fossa, and the fold present and the fossa present between the medial umbilical fold and the lateral umbilical fold is known as the medial inguinal fossa, that is also known as the inguinal triangle or the Hazelbeck's triangle, and the fossa lateral to this lateral umbilical fold is known as the lateral inguinal fossa. And if you see at the supraumbilical level, peritoneal fold you see in the medial plane is the Felsiform ligament. So this is the Felsiform ligament. So thank you so much students for your cooperation. I hope you have understood very well our today's lecture. Even then, still if you have any queries, please you can consult us anytime. And thank you so much and best of luck.